Hello, my name is Monica Quille. My topic is approximate to prevent venous thrombosis in patients with in the cancer. Definition: a venous thrombosis is a disorder that indicates death within the thrombus in the pulmonary embolus. I wet in the thrombus occur and wet and ball in the clot forms. I went in the wet and usually in the lower leg, with and the pelvis. A pulmonary embolism occurring when in the clot's breast, lungs and the travels in the lungs, in the blood's brain and the loop. Patients with active in the cancer have increased risk in the venous thrombosis, with in the result a substantial mortality.
Of recurrent venous thromboembolism or major bleeding event during the 12-month follow-up occurred in 12.8% of the patients receiving edoxaban, as compared with 13.5% of the patients receiving dalteparin. Statistically, this result demonstrated the non-inferiority of edoxaban to dalteparin, but did not demonstrate its superiority. Recurrent venous thromboembolism occurred in 7.9% of the patients receiving edoxaban, as compared with 11.3% of those receiving dalteparin, and major bleeding occurred in 6.9% of the patients receiving edoxaban, as compared with 4.0% of those receiving dalteparin. The authors conclude that in patients with cancer and venous thromboembolism, oral edoxaban was non-inferior to subcutaneous dalteparin for preventing the composite outcome of recurrent venous thromboembolism or major bleeding. Edoxaban's lower rate of recurrent thromboembolism was offset by an increased risk of major bleeding. Full trial results are available at nejm.org.
Application in the nursing. 1. Assessing in the patient in the puzzle limits. 2. Encourage in the patient to express with her furniture Berlin. 3. Assess in the monitor for respiratory fatigue. 4. Creating in the adult alternation bed rest and the respiration. 5. Make in the exit for the patient do bruise in the heads.
A risk score that my colleagues and I developed about 7 years ago, and if they have a score of 3 or higher, they're at really high risk for getting clots. We took the high-risk patients and randomized them to receive dalteparin, which is a low molecular weight heparin, given 5,000 units once a day for 12 weeks, or to observation. We found 2 things. One, we were screening these patients before they even started on the study drug, and we found a very high rate of baseline blood clots. About 9% of patients already had a blood clot before they even started chemotherapy, and that's a really important finding. And it suggests that cancer patients with a score of 3 or higher should really be screened for blood clots even before they start on treatment. A second thing we found was that the rate of VT was very high in the observation arm. It was 21%, and it came down to 12% in patients who received dalteparin.
What do you think this implies then for future therapy?
I think it strongly suggests that cancer patients at high risk can have that risk reduced by using a blood thinner. This study that we reported today is using a self-injection of low molecular weight heparin. An ongoing study of risk cutoff of 2 or higher is using rivaroxaban versus placebo in a global study, about 700 patients, and hopefully we'll be able to report on that next time we meet.
So what should clinicians take home from your research findings?
There is a validated risk assessment tool. It can be used to find patients at high risk for blood clots. They can be at high risk or maybe even have a clot before they start on chemotherapy, so consider screening for those patients, and consider using prophylaxis in the high-risk patients to prevent blood clots.
And constant prongs, not loud in the monitor, not full interaction, flow during interaction. Cons, Thus adjectives more introductional now relevant can now used in the bull in the repassing.
They're predisposed to it if they have malignancy or inherited tendencies to form clots. And the risk of a clot forming in your leg is that it can break off out of the vein in the leg and then travel to your lungs, and which is called a pulmonary embolism, which can be fatal. And what we've done here is initiate a multidisciplinary program involving the surgeons, the medical doctors, the hematologists, the nurses, and importantly the pharmacists in our hospital, in order to develop evidence-based guidelines in order to try to decrease the risk of venous thromboembolism in our hospital. Traditionally, we would handwrite the orders and the patient would be admitted to the hospital, but over the past 3 years, we've implemented electronic medical record here at the University of Wisconsin, wherein there are order sets the doctor can pull up and click on the appropriate things they wish. And so each physician, when they admit a patient to the hospital, have to review, goes through the order sets and reviews the options to prevent venous thromboembolism for their patient. Every patient that comes into our hospital here at the University of Wisconsin is analyzed to what their risk factors are, and based on the type of surgery they're going to have, the electronic medical record makes a recommendation basically on how to care for that patient. The pharmacists also actively review the medical records of all the patients and review the order sets as they come in. And we are encouraging active communication in our hospital between
Using PLI in the Ecuador. Apixaban was in the for medical using in the European Union in the May 2011 and free in the United States in December 2015. It is on the world in the organized list in the Asian medicals. In 2018, it was in the 66th most in the perceiving drug in the United States with in the more 20 millions.
Treatment of cancer-associated thrombosis there's a few different options. There's Coumadin, which has been around forever, but there's problems with Coumadin. Maintaining the INR is an issue, and then patients need to be on different types of chemotherapy drugs, and that can interfere with the levels of INR. So it's really important that we find better anticoagulants to use. And one approach has been to use low molecular weight heparins, which was initially used just in the hospital, but in cancer patients they're used in the outpatient setting as well. And more recently, novel oral anticoagulants or direct oral anticoagulants have come on board, and they're much more patient-friendly. They don't require monitoring. They're 1 pill a day or 1 pill twice a day, depending on the type of anticoagulant. So they're much easier to manage. Currently, ASCO and other guidelines recommend low molecular weight heparins as the standard of care. And what we wanted to do was sort of try and figure out what's happening in the real world and what are patients and physicians actually doing.
In conclusion, apixaban therapy in the resulted in the significant lower risk for venous thrombosis was in the placebo among intermediate in the top with risk ambulatory patients with cancer who were strong in Chamberlain. Thank you.
Hello, I'm Dr. Sam Goldhaber, president of NATF, and today on Clot Chronicles, I'm going to discuss prevention of pulmonary embolism and prevention of DVT in patients who are diagnosed with cancer. Certain cancers secrete substances that increase the body's clotability, and therefore patients with these particular types of cancer, such as pancreatic or stomach cancer or certain types of lymphoma or brain tumors, are at very high risk of developing large pulmonary embolism or large DVT. Furthermore, when these PEs or DVTs do develop, they are more resistant to standard anticoagulation than for patients who do not have cancer. In addition, certain types of chemotherapy for cancer, for reasons we don't understand, also predispose to pulmonary embolism and to DVT. So an ounce of prevention is worth a pound of cure, but until recently we haven't had any strong scientific evidence that prophylactic anticoagulation can reduce PE and DVT safely in patients with cancer, or patients who have cancer and are receiving particular types of cancer chemotherapy. Recently, in the New England Journal of Medicine, 2 back-to-back trials were published about preventing pulmonary embolism and DVT in cancer patients, and these trials randomized the patients either to real rivaroxaban versus placebo or to real apixaban versus placebo, and they found in each of the 2 studies that the direct oral anticoagulant rivaroxaban in one study and apixaban in the other study had a marked reduction in the development of pulmonary embolism or DVT.